All right. Good afternoon, everyone, and welcome to this Minnesota MHA alumni and program event. My name is Jean Abraham, and I am the program director here at Minnesota. I am delighted today that we have with us Dr. Amer Kaissi, who is going to speak with us on the topic of resilience in healthcare leadership. Before I do that, though, I want to take a moment to honor one of our faculty, Dr. Jim Begun, who will be retiring in just a few months. And we wanted to take this time to celebrate Jim's career. So I, of course, have prepared a few remarks to share with you, and I know Jim has a few remarks as well to share today. So as the James A. Hamilton Professor of Healthcare Management, Jim has had a profound impact on the Minnesota MHA program for the past 24 years through his teaching and scholarship, as well as his leadership roles within the program, the university, and the field of healthcare administration. Since 1997, Jim has been educating students about organizations and management theory and its application to healthcare delivery for both our residential and our executive students. His effectiveness in the classroom is illustrated year over year with stellar teaching evaluations and wonderful anecdotes that are shared with us. As one current student noted, Principles of Management with Dr. Begun may be the most impactful class in this program on the trajectory of my career and navigating relationships within healthcare. Of course, Jim's commitment to students and their learning has also been demonstrated with his receipt of numerous teaching awards through the years, including being a three-time winner of the Class of 1981 Faculty Teaching Award, the Leonard Schumann Award for Excellence in Teaching, which is the highest honor granted by the School of Public Health, and most recently as a recipient of the University of Minnesota's Award for Outstanding Contribution to Graduate and Professional Education. In his broader faculty role, Jim has advised numerous doctoral students and junior faculty within the Division of Health Policy and Management. And in this role, he's really been instrumental in developing the next generation of healthcare management scholars, including our keynote speaker today. Jim's contributions are also widely recognized in the field of healthcare administration education. In 2008, he was awarded the Filerman Prize for Educational Leadership, which is given by our national association, AUPHA, to a faculty member who has demonstrated excellence in teaching and pedagogy, academic leadership, and who has influenced the structure and quality of healthcare management education. In many ways, it is the Lifetime Achievement Award for healthcare administration faculty at the national level. And on a more personal note, it has truly been my privilege and honor to have worked with and learned from Jim for the past 2 decades. He is one of the smartest, most strategic, and funniest faculty members I know. He has the innate ability to get an entire room laughing, and really that's such a talent to be able to lead with a sense of humor. He also has one of the best tie collections of any faculty I've ever met. And I don't know what he's going to do with that tie collection in retirement, but I'm sure he'll figure that one out. So on behalf of the MHA faculty, students, staff, and alumni, we want to thank you for all that you have done over the years, and we want to wish you the very best in retirement. Thank you, Jim.
And thank you so much, Jean. You're very kind. And I wish I'd prepared some new jokes for today, but I did, sorry. But remember those words, because I may get bored in a year and come apply for a job again. So don't forget what you said. It's great to see all of you today, even over Zoom. Hello to Bob, hello to Dick, and hello to all you younger people. And thanks for very much for being here. It's been an incredible privilege for me to work in the MHA program for 24 years. I feel really blessed. When I arrived here in the previous century, we were celebrating our 50th anniversary, and I was totally impressed with what James Hamilton had built. Today, I'm even more impressed at how we've sustained excellence for 75 years. And I anticipate a great future based on a continuing supply of the best students and alumni, a really committed and talented staff, and our incredible faculty who outshine the faculty at any other program. We're in great hands with the leadership of Jean and her leadership team of Stephanie Hagel, Justine Mishik, and Ryan Armbruster, the latter two being distinguished alumni, of course. It's been both exhilarating and exhausting to work here for 24 years. It's been exhilarating because I've gotten to work with and learn from the best faculty, staff, alumni, and students in the world. It's also exhausting keeping up with you people, so I'm ready to take a break. And it's not just keeping up with the knowledge, it's the technology too. Apologies to all the students I've kept in the Zoom waiting room this past semester because I don't check it and because I don't know what WhatsApp is when you WhatsApp me to get out of the waiting room. So apologies again. I have lots of great memories, most of them involving students. One is the Walk and Gawk course, now known as the Learning Laboratory, where every alum in the region who was ever asked responded by opening their doors to our first year students in that class. I have a special debt of gratitude to my teaching partner in that course for many years, Greg Hart, class of 76, that'd be 1976, who could not be here today. Greg taught me so much about the profession of health administration, which I sincerely admire, about servant leadership, and about what it means to be a Minnesota MHA graduate. So thank you so much, Greg. Another key to our past success is that we've never compromised quality on the admissions front, believe it or not, even when it meant cutting back admissions in the turbulent years when we moved over to the Carlson School and then back to the School of Public Health. A key to our continued success is competing for the next best class ever, which is now at 40 residential students and 30 executive students. And we're competing with a lot of other programs that are well financed. So I hope that you join me in giving what you can to the scholarship fund. One reason I've loved my job is that once every several years I get to work with a student who already has an MHA and would like to get a PhD to contribute to the field through teaching and research, like our guest today, who Jean will introduce in a moment. Not only has he become a global leader in our field, but he's a warm and wonderful colleague and a friend and a proud alum of the U. And it's an honor to hear from him today. Besides, I said I'm exhausted. I think I may be burned out, which is Dr. Kaissi's topic. So it may be too late for me, but it's not too late for the rest of you. With that, it's been a great honor and a privilege to have served you. And thank you all for your support over these many years. Jean, please introduce Dr. Kaissi.
Thank you, Jim. Wonderful remarks. So I am delighted today to have the opportunity to introduce Dr. Amer Kaissi. Dr. Kaissi is an award-winning professor of healthcare administration at Trinity University and author of the book Intangibles: The Unexpected Traits of High-Performing Healthcare Leaders, which won the 2019 James A. Hamilton Book Award from ACHE. Dr. Kaissi earned his PhD in Health Services Research Policy Administration from the University of Minnesota. And at Trinity, he teaches courses in leadership and professional development and serves as the director of the executive program. His research focuses on a number of topics, including leadership coaching and strategy. Dr. Kaissi is a national speaker with the Huron-Studer Group and is a faculty member with ACHE. He's also a certified executive and physician coach and consults with hospitals and healthcare organizations on their strategic planning efforts. Dr. Kaissi, welcome back to the University of Minnesota virtually here. We're excited for you to join us today. And we'll turn it over to you to begin your talk. And I just want to let all of our audience members know that during Dr. Kaissi's talk, you're welcome to put questions in the chat, and we will hold those and then take some of them at the end in the last moments of our time together today. So with that, let me turn it over to Dr. Kaissi. Welcome.
Thank you, Jean. I appreciate being here. It's an honor and a privilege to be with you all today for this event for the U, and obviously the event honoring the career of Jim, who I also consider a great friend, but first and foremost, he was my professor and mentor. And great to be back and reconnect with the U. And just for those who are thinking, who is this guy from Texas talking to us? I did go to the U, and I have the evidence to show. I have my golden gopher here with me, and he's keeping me company and giving me good luck today. I'm going to share my screen here and introduce the topic, but I'd like to talk a little bit about Dr. Begun and my relationship with him. So we're going to be talking about resilience in healthcare leadership, and obviously it's always been an important topic in healthcare, but man, the last year with the global pandemic, this topic has taken even more importance. So we'll get to that in a minute, but I want to say a few words and tell you a little bit about my relationship with Jim. And there are so many stories I could tell today, and that would take the whole time we have together, but I'm going to start just with the first time I met him. So that's the only story I will share. And I was just arriving as a new PhD student at the U, and that was my first semester, and I was taking 3 courses, and I wanted a 4th course so I can have a full course load. And there was a course I was interested in. It was a course in management and organization theory that Jim typically taught, but he taught it on an every other year basis, and I happened to be in the off year. So the course was not offered, and I really wanted to have another course. So people said, well, go talk to Dr. Begun. So I went to talk to him, and this was the first time that he had met me, right? We hadn't met before. And he asked me about my background and my interests and all of that. And then he just said, all right, well, then I'll offer the course for you. And I'm like, what do you mean? He said, I'll give you the course as an independent study. And I said, but how does that work? I'll be the only student in the class. And he's like, yeah, but we're not going to meet in class. I'm going to give you some readings and assignments, and every 2 weeks, you and I will meet over lunch, and we will discuss the content and the material. And that's exactly what he did. I mean, he had just met me, and he offered, very generously to give from his time and from his expertise to me. And we met at the Carlson cafeteria every other week to talk about management and organizational theory. And I was in heaven when I was taking that course. And I tell everyone, this is almost like learning piano from Mozart, or learning how to play basketball with Michael Jordan one-on-one. I mean, he's the expert on that stuff. And I was getting all of that unfiltered just for myself. And I fell in love with management and organizational theory, and that changed the course of my career and changed the course of my life. So this is just one of many, many stories I can tell about Jim and his compassion, his kindness, and his mentorship to me. So thank you again, Jim, for everything you've done to me and to all of the graduates from the MHA program and from the PhD program. I know they all have a lot of, they look back at their time with you with a lot of warmth. So I got the thumbs up from Jim. It means I can move on to the content. So what can you expect for the next 30 minutes or so that we're going to spend with each other? Most important thing for me today is that you leave with at least 1 or 2 practical take-home behaviors, especially for those of you who are working right now in the industry, in healthcare, day in and day out. Now, obviously, this topic of resilience is not a new topic. You've heard about it before, and many people have addressed burnout. But my hope is that you get a fresh perspective on some of these old topics. And I hope to bring these fresh perspectives by presenting the research. So what does the research say? What does the evidence say and the latest science on chronic stress, burnout, and how we build that resilience muscle? In addition, I'd like to keep things a little bit, balanced between the right brain and the left brain. So in addition to the data and the numbers, I'm going to share some examples from my coaching. As Gene mentioned in the introduction, I am an executive coach, and I work with a lot of leaders who are facing some of the challenges that you all are facing these days in terms of how to remain resilient, but also how to keep their teams resilient at the end of a very, very long year where everyone is exhausted. So I'll share some of these examples, and I will have some book recommendations in there for those who would like to go a little bit deeper into some of the concepts. And finally, to keep things a little bit light, we'll also share some sports examples, because I know it's the end of the day and we can't have things be too serious. Now, speaking of sports examples, I've lived in San Antonio for 20 years now. I moved here straight from the Twin Cities. And, when you live in San Antonio, you are a Spurs fan. So the story I want to share with you is from the San Antonio Spurs. Now, those of you who are not that familiar with the Spurs, the year 2013 was not a very good year for the Spurs. So that's the year when the Spurs reached the NBA Finals and they were playing the Miami Heat. And the Spurs were actually up 3-2 after 5 games, and this was Game 6 in Miami. So naturally, the Spurs had a chance of clinching the title in that Game 6. And because of that, the Spurs organization decided to make dinner reservations at a fancy restaurant in Miami. In the case that they win the title, they wanted to celebrate in Miami and then catch a flight back to San Antonio. Now, at this Game 6, the Spurs were actually doing really well. They were up by 9 points with a few minutes left. And then the Spurs just collapsed. The Miami Heat started coming back, and then Ray Allen, if you remember, sank a three-pointer at the buzzer, and the game went to overtime. And then the Miami Heat ended up winning that game. Now, the Spurs players were devastated. I mean, they were this close to winning the NBA titles, and they just let it slip through their fingers. Naturally, the players were thinking that the celebration dinner was going to get canceled, right? Because they lost the game. However, Coach Greg Popovich, the Spurs coach, had a different idea. He said, no, we're actually going to have the dinner. And what he did was he drove by himself to the restaurant and made sure everything was well set for the dinner. And then he was there waiting for the players to come off the team bus. Once everyone came off the team bus and went inside the restaurant, Coach Popovich made sure to talk to them for about 5 to 10 minutes about why they lost the game. He took ownership for the loss, but he assigned accountability to the players. But that was it. He talked for 5 to 10 minutes about the game, and for the rest of the evening, there was no talk of basketball whatsoever. Instead, what he did is he went and he talked to every single player, one-on-one. He put an arm around them, and he asked them about their family. He asked them about their loved ones. He helped them order food, ordered a lot of drinks too. He did the same with the wait staff. He went and talked to them and thanked them for their service. And it was just a nice environment of compassion and empathy towards the players who have been had just suffered from a very significant loss. Now, the Spurs didn't win the NBA championship that year because they ended up losing Game 7 too. But they came back the following year. They played the Miami Heat again, and they ended up winning the title. The really interesting thing is when the Spurs players were asked in 2014 after that win, what was the secret of that success? Many of them pointed back to that dinner after the difficult loss in 2013 and said that was the reason why we came back strong. That night, Coach Popovich, with his compassion and his empathy, he built our resilience, and that's how we became a resilient team. Now, I start with the story because I really like the lesson from the story in that resilience can be built within a team, and it can be built by balancing empathy and compassion with accountability. But I also want to point the role that leadership plays in building resilience within teams and within organizations. And I want to urge you all that each one of you can be Coach Popovich. Each one of you is responsible for a team, for a department, for a number of departments, or for a whole organization or system. And you have that responsibility, not only to build resilience in yourself through self-care, which is what we're going to talk about today, but also to build resilience within your team by showing them gratitude, empathy, and compassion. So the plan is for us to talk about resilience in terms of dealing with setbacks and handling stress. I'm just going to offer after that a few tips on how we recharge as healthcare leaders and leave you with some take-home behaviors, just some nuggets that hopefully you can take back with you to the office tomorrow morning and that you can share with your team, you can teach your team members and share and spread in your organizations. So let us get started with this concept of resilience. You know, I do a 2-day workshop for ACHE on resilience, and I typically have about 25 executives in the room. And when I ask them, define resilience, I get 25 different answers, right? Each one of us has our own understanding of resilience. So it's important to start with a common definition. Most experts say that resilience can be categorized into 2 main buckets. It's about dealing with setbacks, but it's also about how we handle stress. So let's talk about dealing with setbacks first, and then we get to handling stress. When it comes to setbacks and stress, I mean, the last year has had a lot of it, especially in healthcare. You know, the nurses that I talk to talk about the mental fog that they're feeling these days. The healthcare leaders talk about this pandemic fatigue. The doctors are talking about this work-life blur. They don't know where work starts and where life starts, right? And everyone is talking about this extended vacuum or this endless wait that we all find ourselves in. Unfortunately, there's been a lot of setbacks and a lot of stress that we all have had to deal with. One of my executive students in the Trinity program was telling me about a time back in November. He's a physician leader, but he also still practices medicine. He was telling me about a time back in November when the cases here were really crazy, where he would sit in his car in the parking lot every morning and ask himself, can I do this for one more day, right? Can I show up and lead and manage and take care of patients at the same time? So we all know this reality, which leads us to the question, then how do we develop that resilience, right? How do we deal with these kind of setbacks? And what does the research tell us? So the first question is to ask, what types of people tend to be more resilient than others, right? What characteristics do they have? And the research points us very clearly in the direction that resilient people are optimistic, all right? Now, they're optimistic in that the way they interpret setbacks is a little bit different than other people. They interpret setbacks in terms of 3 main factors. They think of them as temporary, right? It's going away quickly. They also think about them as local. It's just this one situation. And finally, they interpret setback as changeable. I can do something about it. I have some agency in here. So if we take this and apply it to the last year with the global pandemic, resilient people thought about the COVID-19 pandemic as, yes, it's here, it's important, it's significant, it's unfortunately affecting a lot of people, but I believe it's going to go away at some point in time. They also thought about it as a local situation. Sure, it's a global pandemic, but it's only one situation in my life. There are so many other things happening in my personal and professional life that are positive, and I can choose to focus on these. And finally, they thought about it as something that they can change. Now, maybe they can't themselves, cure people, or they couldn't themselves find a vaccine, but at least there were aspects of their job that were under their control that they could impact and they could affect and change. So when we start thinking about resilient people as being optimistic, it's important to remember that it is not naive optimism. Rather, it's optimism that is balanced with reality, right? It's optimism where you think to yourself, yes, this is significant, this is important, we are in trouble here, but I believe that we can prevail. So to put this more visually, the naive optimist, as someone who thinks of the glass as half full, right? The cynical pessimist is always thinking the glass is half empty. The realistic optimist sees the glass exactly how it is, right? So this is how we define realistic optimism. And this is one of those situations where I miss being in the same room with the audience, because this would have been one of these situations where it's nice to hear some laughter and see people enjoying themselves. On Zoom, unfortunately, we don't have the luxury of that interaction, but it's okay. So a few years ago, Sheryl Sandberg and Adam Grant wrote a great book dealing with that resilience. And what they talked about was that resilience is not something that either we are born with or we're not. Rather, it's a muscle that all of us have, but we need to strengthen that muscle. Just like we go to the gym to work out our biceps, or we run every day to prepare for a marathon, resilience is something that we have to work on every day so that we can keep on maintaining it and building it. We said the first aspect of resilience was handling setbacks. The second aspect is how we handle stress. Now, it's important to remember that stress is good for us, right? A certain amount of stress is good for all of us, but it's the chronic stress that we're talking about, right? It's the chronic stress that we've all had to face in the last year or so that sometimes can lead to burnout. If you don't remember anything from what I'm sharing today, I'd like you to leave with this. Resilience is about how we recharge, not how we endure. In my conversations with a lot of healthcare leaders over the last few years, I came to the conclusion that we got resilience in healthcare backwards. We think that being resilient is about enduring. And all of the science, all of the research actually shows that resilience is about how we recharge. Let me explain. So what we think resilience is and what resilience actually is are totally different. We think resilience is only about enduring, but the evidence shows that resilience is about recharging. We think to be resilient is to suffer, but actually it's about how you recover. We think that if I just power through for a few more months, I'm being resilient, and it's not that. It's about how I can continue to refuel so I can show up again the following day, the best version of myself. And finally, we think if I just grind through, I'm demonstrating resilience, and it's not that. It's about how we rest. So this is the 4 R's of resilience, as I call them. And I want to talk with you about these aspects of resilience and what the research actually shows us in terms of how we can build these, but also what happens when we don't take care of ourselves in these ways and we don't recharge or recover or refuel or rest. So the research on resilience, I would like to start from outside of healthcare, from an example from outside of healthcare. Typically, when you think of an environment that is a chronic stress type of environment with crazy workloads, you go straight to investment bankers, especially young investment bankers. So it's well known that young investment bankers in the first 5 years of their careers go through a grueling schedule. All of that with the promised payback of very generous compensation later on in their careers. Now, the researcher, Alexandra Mitchell, what she did actually was she embedded herself with young investment bankers that worked about 15 hours per day, right? So these were people that were pulling 15 hours per day every single day for a few years. And she went there and she studied them because she wanted to understand the impact of this kind of schedule on people. And here's what she found. First, the physical impact of having this kind of extreme schedule. It starts with weight change and hair loss and panic attacks, but then it leads to chronic diseases, diabetes, heart problems, and even cancer at much higher rates than the general population. But not only that, more important than the physical impact, there is the mental impact of this grueling schedule. At least all of the investment bankers that you studied had at least one addiction. But not only that, they demonstrated loss of empathy, and many of them have depression and anxiety symptoms. What's really telling is what one of those investment bankers told Alexandra Mitchell in the study when she interviewed them. He said, when you lose the feeling for your body, and we don't have any compassion or respect for yourself, you start doing that to others. So bankers who have been riding themselves become people eaters, and that's what leads to toxic environments in these kind of organizations. Now, you may be thinking to yourself, well, these are investment bankers, we work in healthcare, what is the connection? Well, let us think about the working conditions of healthcare administrators before COVID, but especially after the COVID pandemic. High workload, right? High stress, fast-paced environments. We all know that this is the kind of environment we work in. Long hours are expected. It's a rapidly changing environment, and there are always high expectations. And the work itself is emotionally draining. Yes, it may be fulfilling because you know that you're helping patients and helping the community, but that doesn't mean that the work is not draining. And as a result, I would argue that, of course, we are at the risk of burnout. I know many of you have heard a lot of talk about physician burnout and nurse burnout or clinician burnout in general. But I'm here to say, based on my experience and the conversations I've had, but as well as the research that I've seen, is there is administrator burnout. Leader burnout is a real thing in healthcare. In my conversations with the executives that I coach, I ask them, what are your struggles with recovering, right? I was making the argument that resilience is about recovering, not about how we endure. So when I ask them, what is it that prevents you from recovering? Here's what I hear from many of them. We have some mindset obstacles to recovering in healthcare. We have some self-limiting beliefs that we have taught to each other and that we have convinced ourselves of. Here's what I hear. I hear people say, if I'm not here to fix the problem, everything is going to fall apart. Or if I don't work on my vacation, so much will pile up that I may as well have not left. Here's what other people tell me. They say, working nights and weekends is the only way I can demonstrate my commitment to everyone. And finally, the most common self-limiting belief that I've seen in healthcare is that if I don't suffer, then I won't succeed. Now, of course, some sacrifice is necessary for success, as we all know, right? You need to put in the hours. But we have convinced ourselves that we only have to work and we don't have time to recover. We don't have time to rest and refuel. And the numbers support that, not just in healthcare, but in all industries. Americans choose not to take about 700 million vacation days per year, right? And many of these are just left on the table. No one takes these vacation days. It's almost like you're giving back a charitable donation to your employer. That's exactly what's happening. Now, when I talk with people and I say, why is it that you don't take your vacation days, right? Why do you leave some days on the table? Many of them express concerns that if they take their PTO days, that might impede their advancement. However, the research is very clear that taking time off can actually help our careers, help improve our careers. Wait, you're wondering yourself, what are you talking about here? Let me show you the research that supports this claim. So a few years ago, Harvard Business Review published this article that compared people who take at least 10 vacation days per year versus those that don't take those 10 vacation days, right? And then they asked them, they said, have you had a raise or a bonus in the last 3 years? And the evidence was very clear. People who take more vacation days tend to get more raises and more bonuses. So we can see here this positive career impact of taking a PTO, of taking all of your PTOs is significant for people, in all kind of different industries, but especially in our healthcare industry. So we've talked about dealing with setbacks and we've talked about handling stress. Let's talk a little bit now about how we can recharge. I'm going to make a case for recharge based on four main components. It's about how we rest, how we reflect, how we establish boundaries, but also how we get enough sleep. And I know what you're thinking. This is all common sense, and I totally agree. It is common sense. Unfortunately, especially in our healthcare industry, it's common sense that is not commonly practiced. A few years ago, Brad Stulberg and Steve Magnus wrote a magnificent book called Peak Performance, where they went and they studied peak athletes, right? Top athletes. You're talking about triathlon champions, Olympic champions. And they were trying to understand what differentiates those people from the very good athletes. So what differentiates the excellent from the very good? And their main conclusion can be summarized in one simple equation. And that simple equation is stress plus rest equals growth. So stress is necessary. But what these athletes did is that they treated rest as part of the training rather than as separate from the training. And this is something that I've been trying to convince healthcare leaders to think about, is to think of the time that they take to rest, to take care of themselves, not as a luxury, not as a selfish act, not as something that is separate from the job, but something that is an important part of the job itself. So what does it mean to rest? Sometimes I wonder, do I really need to have a slide on rest? I mean, it's that straightforward and that much common sense. But again, when I talk to a lot of healthcare leaders, I find that they need the reminder. it's really about just taking short breaks throughout the day and taking a lunch break and going out. I know now the weather hopefully is starting to become a little bit nicer up in the Midwest. So take a lunch break every now and then. Now, no one is naive enough here to say that you can do this every day as a healthcare leader with a lot of responsibilities. But start with micro steps. Start by setting a goal for yourself where I'm going to do this at least once a week, right? I'm going to take 5 minutes, at 10 a.m. and at 3 p.m. just so I can catch my breath and look out of the window and make sure I'm showing up better for the next meeting. Taking time to reflect, right? This is what Daniel Kahneman talked about in terms of thinking slow versus being on autopilot and thinking fast all the time. In the coaching circles, we refer to this as heads up time, right? Versus heads down time. We're constantly in heads down time, putting out fires and taking care of problems, but every now and then we have to give ourselves the chance to have some heads up time so we can look at the big picture and think about important things. It's also about taking the time to journal. A lot of leaders find that to be a very important practice, journaling in the morning or in the evening. And finally, dare I say, take some time to meditate. Yes, meditate. I know this is not very well accepted in some business circles, but there's plenty of evidence that shows the importance of meditation. Now, whenever I talk about meditation to executives, the first thing that comes to their mind is the image of, a Buddhist monk somewhere up in the mountains in a cave, sitting for hours at end. And they think that what I'm advocating for is that we do this at the workplace. Now, if you can do this, if you have the luxury of time and space and you do this at work, good for you. But this is not really what I'm talking about. I'm way more practical than that, and I know that time is limited. So what I'm advocating for is something called express meditation, which takes 6 minutes at the beginning of every day. So if you don't have the time for, longer meditation, try this. It's a 3x2 morning prioritization kind of exercise, where the minute you get to your office in the morning, rather than go straight to email, which is what we all do, sit and let your mind settle. Just focus into calm and clarity for 2 minutes. The next 2 minutes, think about what you want to achieve that day. And then for the last 2 minutes, look at your calendar and try to make sure that you find a time for your most important priorities in between all of the meetings that you have scheduled on your calendar. That's it, right? It's practical, it's doable, everyone can do it. The people who have put this practice in place tell me that it's been a life changer for them in terms of allowing them to gain perspective on their days. So we talked about rest and reflection. Now let's move on to establishing boundaries and then sleep. Signs that our work and personal lives are out of alignment. You can tell if you find yourself eating junk food for most meals, right? If you're not working out like you used to do before, and finally, if you're not visiting with family and friends. Now, again, I talk about work-life alignment rather than work-life balance because I believe balance is a myth. For high-performing people, there is no balance. But at least there can be some alignment, and that could be achieved by setting boundaries. Boundaries can be achieved by being practical with yourself and saying to yourself, I'm going to follow these rules 85% of the time. For example, I'm not going to work after 7 p.m. or not going to work on Sundays or days off, while recognizing that some of the time there's going to be projects or deadlines that require you to do that. But that becomes the exception rather than the rule. My last tip to share on work-life alignment is what I call calendar triage, especially for people who find themselves overwhelmed. I say look at your calendar for the next 2 months and decide what are the things that you can delegate. What are the things that you can postpone? And finally, what are the things that you can just cancel? What are those meetings that you're going to just because you've been going to for the last 2 years and there's no reason for you to be there? You're not bringing value. You're just going because you keep getting invited to that meeting, right? Take off that meeting of your schedule and schedule some reflection time or some deep thinking time. All right, I don't know if you all heard recently, CNN came up with some breaking news about some new treatment that can make our lives younger and make us live longer and make us younger. They say that it can enhance our memory, it can make us more creative, it can even make us more attractive. We can lose weight, will protect us from chronic diseases, will lower our risk of heart attacks, and we also, if we take that treatment, we can feel happier, less depressed, and less anxious. And by the way, this is based on about 17,000 peer-reviewed study and article. And I think that if that treatment was available on the market, we will all be asking our doctors about it, right? And what is that treatment? Yeah, you guessed it, it's sleep. It's a full night of sleep. We have enough science, enough research now to show that all of these claims that were on the previous slide have been supported by the research. And what is the cost of that treatment, right? The cost is just free for most of us, right? So I highly encourage all of us to rethink our sleeping habits, and in addition to setting an alarm for waking up, also set an alarm to go to bed at a reasonable hour. It's no surprise that a few years ago, Jeff Bezos said that he gets 8 hours of sleep per night. Now, I get it. If I had $200 billion in the bank, I would be sleeping very well too. But the point here is that he said that getting 8 hours of sleep is not only good for him, it's good for Amazon shareholders, which tells us that when we get enough sleep, it's not just for us, but it also helps us show up as the best version of ourselves as leaders the following day so that we can make the best decisions for our organizations. All right, we're reaching the end of our time here, so I'm going to wrap up with just some straightforward take-home behaviors here. My suggestion is to build that resilience within our teams is to practice gratitude and practice compassion. I talked a lot about self-care and how we can take care of ourselves, and that's important. We have to put on our oxygen mask first before we put it on others, but then we have to also extend it towards others. So gratitude, practicing gratitude, we have tons of research now that shows that people who take time to reflect on what is going well in their lives on a daily basis or on a weekly basis through a kind of a gratitude journal, they tend to be happier and more satisfied with their lives. But it's not just about gratitude with yourself, it's also about gratitude towards others. So one of the tools that I highly recommend to people is a handwritten thank you note. Write a handwritten thank you note to someone who is going up or beyond on your team, or to someone who has had a positive impact on your life, and show them that. The research shows that the impact is not just on the receiver, but the impact is also on the giver. People who write thank you notes on a continuous basis tend to be happier and suffer less from depression and anxiety. The other main practice is that I want to point out to is that, in this fight against burnout, I've talked a lot about self-care. And self-care is necessary, but not sufficient. To really beat burnout, I believe we also need to take care of each other. And to do that, we have to practice empathy and compassion towards each other. When I think about empathy and compassion, I think about it as operating at 3 different levels. First, at the cognitive level, it tells the other person, I understand you. At the emotional level, it tells the other person, I feel for you. And finally, at the behavioral level, it tells the other person, I want to help you. So the first 2 of these are what we refer to typically as empathy, and the last part is compassion, right? And I believe that we all need to be intentional about displaying these types of behaviors to our healthcare team, to our already exhausted healthcare teams. I often get the question, all right, this business of empathy and compassion is great, but what can I start doing now as a leader? And here's one suggestion I have. At your next meeting or your Zoom call, start by asking your team members, what have you done in the last week to take care of yourself? All right, just make that the beginning of every meeting. And the impact of that is that you make that conversation legitimate in your team and in your organization. People become more and more comfortable to talk about taking care of themselves. And you model that behavior by talking about how you have taken care of yourself over the weekend, or how you went for a walk in the park last evening. And people become more and more comfortable with that, and we start fighting some of those self-limiting beliefs that I mentioned earlier, in terms of thinking that resilience is about how you endure, and we all buy into the idea that resilience is how we recharge. Thank you all for your time and for inviting me to this great event. I mean, and as I'm talking about empathy and compassion, I feel that this is very fitting as a topic to be, again, honoring Jim today, because these are behaviors that, in my experience, he always showed towards me and towards many others. So thank you again for the invitation. Thank you to Jim for all of the great things that he's done. as Gene mentioned, my book is called Intangibles. So if you find some of the content interesting, please check it out. Let us connect on LinkedIn. If you're on LinkedIn, I'll be very happy to connect with you and continue the conversation. And then this is my email address if you'd like to reach out by email. And before I stop here, I just have some exciting news. I'm going to do some shameless self-promotion here. My new book is coming up very soon, and it deals with the importance of humility and ambition in leadership. So if you're interested in these topics, please be on the lookout for it. And I'm going to stop now, and we'll see if we have any questions we can answer.
Very good. Amer, thank you so much for a wonderful talk with really great pragmatic suggestions. We do have about 12 minutes or so for questions, and I see that we have some in the chat. And so I want to go ahead and get started kind of walking through some of those. And again, encourage others to feel free to put something in the chat if you'd like to ask a question. So maybe we'll start with Candace Dow. And Candace, you're welcome to unmute if you'd like. I think we're a small enough group today if you'd like to ask your question, or I could go ahead and ask it for you. Go ahead.
Hi, good afternoon. Thank you for talking. When you talked about people not taking PTO, there are some people who work in the gig economy. So by taking PTO, they reduce their net income and they wait until the end of the gig and get their PTO paid out. And I realize that's probably not the case with most salaried individuals. But that is something that I've noticed with people who do gig work.
Thank you, Candace. That's a great point. And you know, obviously the research that I cited was among you know, people who are salaried. But I would argue that the principles apply to whether you are salaried or not, or whether you're working on a project by project basis or not. The main idea is to be intentional about taking time off, right? And to recognize that taking time off is actually part of the work, and not to think of it as a luxury, or not to think of it as doing something selfish, but rather to convince yourself that when I take an evening off, or when I take a Saturday or Sunday off without checking my phone, without checking text and email and all of that, I'm actually giving myself some very highly needed recharge and refuel time, and I'm giving myself the chance to show up as the best version of myself on that, you know, following day or following Monday.
Another part of that is sometimes now with flexible schedules, people can take time off without losing any income by flexing their schedule. So that's another way that people sometimes do that. And I also should have said thank you for being with us today, and I appreciated your topic.
Oh, it's my pleasure. Thank you for that great question.
Very good. Our next question, actually Heidi posed this earlier on, which had to do with the research that you presented in terms of the paid time off, the correlation between paid time off and raises and bonuses, and whether that was looking across workers of different types or inclusive of individual contributors and leaders, trying to understand a little bit of kind of the relationship and what was controlled for.
Yeah, I believe that research dealt mostly with people in leadership positions, but I think the question being raised is also important, and whether that you know, also applies for people possibly at, you know, at the front line. So that specific research was mostly at the leadership level. And honestly, to tell you the truth, the research shows that people at the front line don't have that much trouble taking time off. It's the people in leadership positions that typically leave those PTO days behind, and that's why the researchers chose to focus on that subgroup in the workplace.
Very good. All right, Richard Culbertson, you have a comment about sleep and TV. Do you want to ask that?
It was meant in jest, but yeah, you got to have priorities. So they don't show Schitt's Creek until 11:30 down here at night in New Orleans, and you can't miss it. So if I can't sleep, tough.
Yeah, and you know, I know this is you know, said as in just, but it is a good point that you're raising there, in that so often many of us don't work hard enough on setting these healthy sleeping habits, and as a result find ourselves doing all kind of different things before bed. One of them is watching TV at a late hour, or the most dangerous one is going on your phone, right? And there's all kind of research that shows now that people who leave their phones out of the bedroom altogether, have kind of set up some time where, I'm going to go to bed at 10:30, so at 10 I'm going to put my phone in the kitchen and then go to the bedroom and read a book. They tend to get a much better sleep. And we have the luxury now of a lot of advanced neuroscience research that shows us the impact of going without the required sleep. One of the things that I used to hear a lot when I talk to people about sleep, especially in healthcare, especially with leaders at the high level, people would say, "Oh, I'll sleep when I'm dead." And, the research shows that actually if you don't get enough sleep, you might be dead very soon. So that's the luxury of the research that we're looking at right now, is it's showing us the negative impact of not getting the sleep that we all required. And it takes away that claim that oh, I can go without sleep, or maybe there's 1% of us that can go on 5 hours of sleep per night and be totally functional, but the rest of us, the science shows we need our sleep 7-8 hours every night, and there's just no other way around it. I mean, if we think about sleep, if it was not beneficial for us, we would have evolved out of it long time ago, right? Think of it, 7-8 hours every night that are unproductive. If these were not good for us, we would have evolved out of it and we wouldn't need it anymore. But yet it's still here, we still need it, which tells us that there's a huge benefit in it for us, both physically and mentally.
All right, Amer, we have a question from Jim Hart. He asks, do healthcare leaders have an obligation to advocate for a more sane healthcare system? And I'm guessing around work-life alignment and just in general, kind of the load of the demands. Jim, feel free to add to that.
Yeah, no, you got it, Jean. Thanks. Yeah, I guess kind of a moral obligation almost. I mean, it's kind of like public health and medicine. Are we going to just pick up the pieces after people are sick, or are we going to look upstream and try to work on the determinants that are causing the stress? If you see what I mean.
Yeah, I agree with you, Jim. I think it is an obligation that leaders have to start these conversations about the importance of alignment, the importance of self-care, the importance of recharging and refueling, and make this a more legitimate thing to talk about in healthcare organizations, and to model these behaviors, right? To start modeling these behaviors for a CEO to come in and talk to their staff about the fact that they need a good night's sleep, or that they need to take a whole day off on the weekend so they can recharge. Once our leaders start talking more and more about these things and make them more acceptable, I believe the rest of healthcare will follow, and we will have more and more organizational practices in place. And I saw the next question from Miguel asking a little bit about that, about how we put organizational practices in place. I truly believe that everyone can start doing that within their circle of influence, right? You may not be a CEO yet. You may be an up-and-coming young leader, that only has a small team. But if you can start modeling those types of behaviors within your team, then at least your team will start talking about these things and start accepting the importance of them, and people will start sharing best practices, and then this type of mentality will spread across organizations, and then cultures will start changing gradually. And I'm not naive to think that this is going to happen tomorrow or next week. I know we are far behind in healthcare, and we still need to get work done, right? I mean, this is not, I hope that no one is interpreting my, strong suggestion that we take time to relax and rest and refuel as a call for laziness or not doing our job. In fact, it's the opposite. I believe that we can actually get much, much more done if we recharge and refuel, and we can have better outcomes for our patients and our employees if we are showing up well-rested, recovered, and fully present as leaders.
Right. We have a question from Lance Udi who asks, how does the US compare to other nations with regard to burnout, self-care, and work-life balance or alignment?
Yeah, there's tons of research on that, and you know, if I'm to overgeneralize here and just to summarize, you know, years and years of research into one or two sentences, I would say we are far behind in terms of our work-life alignment. We take less vacation days compared to the Europeans and you know, the Asians and the Australians. We have higher rates of chronic stress and of burnout, and we don't know how to recover. I'm sure many people who have been traveled overseas can have observed that just by walking the streets and seeing how people in Spain will take 2 hours for a siesta, or how people, you know, in France will take a whole month off and don't check email. I mean, France, you know, a few years ago passed a law that said it's illegal for an employer to expect their employees to check their email after work hours. And just think how far we are from that. So again, I'm overgeneralizing the research here, but we're definitely far behind that. And I would say healthcare is far behind other industries.
Very good. What an excellent set of questions and responses on this super important topic that spans healthcare, academia, and lots of other industries. And hopefully everybody was able to everyone was able to take at least one nugget away that they can implement in their lives to help get a little bit more resilient and rested. Amer, I want to thank you again for just an excellent session. And I want to thank all of you who took the time out of your schedules to join in today and to celebrate Jim Begun and to listen and learn. So we can give everyone a virtual round of applause. And